Let's get Dr. Hoa, Dr. Nguyen of the American Medical Center Family Clinics. Dr. Hoa, good morning. Happy Monday.
Good morning.
Good morning, guys. Morning.
Well, you're just walking into the bomb blast this morning, but I know you never shy away from the fallout.
It's okay. What's up?
So I guess first question, how do we handle the news that there are 6 patients who had recovered now testing positive for COVID-19?
Those patients, we learn a lot from this virus every day. And, we know it happened in Korea, in South Korea, and it happened here. And, there's 2 possible reasons. Okay, one is that the virus never go away, and they still have an infection there, or the infection go away already, but we pick up just that particle of the virus. And that's the best choice that we hope, is that we just pick up this that virus particle that the tests pick them up, and not a true recurrent infection. So precaution-wise, those patients will be back in quarantine again. 2 weeks.
Quarantine or isolation?
Isolation, and for another 2 weeks or so, until they be retested again. But I don't think the literature out there to tell them that, hey, they are infectious as before. But again, no one knows for sure, because we're still learning on this virus. So there's literature out there somewhere that say different things. So right now, precaution-wise, just isolate them to make sure they don't come in contact with other people, just for possible if they still infectious.
Do we know if they're still at home isolation, or were they brought to the government isolation facility?
That one I don't know. I'm not quite sure. We brought that up to public health about 2-3 weeks ago, because we saw some patients that 1 or 2 patients of ours that have recurrent positive after they be cleared by public health. So I think if you can put them in home isolation, it's okay, as long as public health deems that their home is safe for them to stay. And it's an option for the patient always to go to quarantine if they choose to be, to protect their families.
Wouldn't they have to sanitize their home, disinfect their home? Do you know what I mean? Like, if I'm recovered, and I'm sick again, would there have to be a process to disinfect the house?
That's the logic people want, but I'm not quite sure it's be done. Again, it's just, we're not really sure right now. We just basically take the most cautious approach is basically to isolate them. But again, time will tell if these people are still infectious or not. Like I say, the study from Korea showed that it's not infectious. Again, it's just the dead particle that they pick up. So
Okay, so should we be out testing the other 126?
Oh my God, that's not a, it's not a real, it's a right or wrong answer. The thought is that we go out and test all this, all these cases possibly before. I don't think so. I don't think we're going to go back and do the test on everybody. Now the real challenge is have a serology test that we can check on future positive that they have an IgM, IgG, just to tell you that the body has an immune system to handle this virus or not. But we don't have a reliable serology test yet approved by the FDA. There's a lot of the countries that have it. It's just that we don't have one approved by the federal government.
You mean through an EUA or?
Yeah.
Or EAU?
But it has.
What's this got to do with South Korean test kits, Doc?
It has nothing to do with it. It's just that it's not approved by the FDA yet. We have a lot of test kit out there that on island that we can do, but unfortunately we cannot use it just because it's not approved.
Right. But Doc, I mean, I think the obvious question here is, if we are having patients who they're churning out these recoveries, this guy's recovered, now they're testing positive. Mm-hmm. What would you say to those people who, because of this, have even less faith in the tests and the process that we're using?
Yeah, it doesn't hurt to do a small study and see if we can, just go ahead and use the serology test. That I know it's not FDA approved, but it's an academic way to test those people, right? But like I say, we as a group of physicians want to start that study, but mind to be say no, so we kind of stuck. Mm-hmm. So we actually that's the study that we want to implement on the public health and UOG study, but someone up there saying no, so we couldn't start a study.
Go back. You said somebody said no?
Yeah, they don't want them to use the South Korean test kits because someone is bothered by it, right? Doc, is that what it is? There's someone at Adelup who does not want anything to do with these South Korean test kits, yes or no?
Yes.
Is it because of politics, Doc? Is that your take on it?
We don't have an answer coming back to us, but I know that physician-wise, 100% of us want to carry through the study. But again, we're not the one to make decision. We can make the recommendation, but someone up there to say no to the whole thing, so everything kind of stands still.
Who's saying no?
Sabrina, I can't tell you that. It's really. Like I said, I'm not quite sure of who. Seriously, I'm not quite sure who say no to that study. I wish I know, and we ask for the person saying no to come forward. Just because as physician-wise, we want to do the best for the island. I know it's not the FDA-approved kit, but again, it's something that we can use just for the study for our island. Again, it doesn't really hurt anyone to harm anybody just to do the study, because every test we do is backed up by the PCR test, which is an FDA-approved kit. So, that's what the study means, is that you just do it, make comparison, and write things up in order for us to understand this virus a lot more. Mm-hmm. So, it doesn't hurt to do anything, because like I said, it's not a treatment, it's a study. And it's just a blood test. It doesn't, just like you do an accurate check for your sugar. Mm-hmm. It gives us more information for us to take care of ourselves.
And this is similar to what they did with the Theodore Roosevelt.
Yeah,
where they did the serology testing.
Absolutely,
study.
It doesn't hurt at all to us to do that. We have thousands of kids here on the island that we can use. It doesn't, like I say, what an accurate check to check for your blood sugar, does it hurt on anybody? No, it doesn't hurt. Mm-hmm. But again, it's the whole panel of physicians say yes, but
the whole panel. You mean the Governor's Physicians Advisory Group?
Yes.
Okay, so the Governor's Physicians Advisory Group says yes, let's do this study using these South Korean tests, these serology tests, and somebody at Adelup, which you are trying to figure out who, has said no.
Yes. So we have other options. The issue is not dead yet. We might,
I remember the governor said it was a dead issue.
Where are the tests? Who brought in these test kits? You said there were thousands here on Guam.
Yeah, that's a lot of wholesalers that bring the kits in. They knock off it. They have it. They release back to them, but they can't use it. So it's not a dead issue. We will still approach it. We're going to probably fund it privately rather than fund it through the government to try to get this thing to go forward. Because to us, it's just give us.
It's kind of crazy, Doc, that they'll spend $500,000 on 2 weeks of hotel rooms, but they won't spend on these South Korean test kits.
Yeah, but we're going to try to figure out who makes the decision. But I really, truly, all of us say it doesn't hurt. It's a blood test. It can tell you yes or no, and again, it's backed up by PCR, so it's not like you're going there blindly.
What do you think, though, Doc? You're such a smart. I mean, I look up to you. Is this just about the politics of it? Is it because, former Senator Dennis Rodriguez is the one that kind of floated it with the speaker, and they're just like, oh, hell no?
Christopher, we really like to stay out of politics.
I know. It's unfortunate.
I mean, this is all about taking care of our people here in Guam, and try to gain a little bit more knowledge ourselves. We read the news, we read the article, read everything else. But, like I say, other places, they do use it, even if it's not FDA approved. But they do use it in emergencies. So in case of emergency, it's not like we're using the kit for diagnosis somebody. It's not. We use this thing as a study to screen to see what the correlates IgM and the PCR.
Basically, it is what the Theodore Roosevelt is doing. The Navy is doing in conjunction with the CDC. Over the past, 2 weeks ago, they conducted these serology tests. They took samples from volunteers, people who volunteered, the sailors. They took all of this and they sent it over to CDC in Atlanta, and it's going to take, till the end of the month to get the results, and it's specifically to study the outbreak. Right? It would be the same situation.
It's the same study. It's a different kit, the same study. It's again, it's a study. It's not a treatment,
a study.
Right. Yeah.
But again, like I say, it's not a that issue. Some private clinic will try to carry this thing forward because we need to know. We just need to know. And like this case, that recurring case, it's beautiful for us. It's just prick the finger. It doesn't hurt. So we can see what do they have the IgM or not, or what happened. So. We don't have to say to the world, hey, this is our study, but this is for locally. We would like to know.
Right. Doc, I got to ask you, because you were in that press conference Thursday, and, you come on the show all the time, and for you to be sitting in that press conference and to kind of be attached with this whole muting of the media, how was that uncomfortable for you? What was your take on that? Because I've just in talking to you, you seem to be very supportive of transparency, and you'd never hesitate to tell us what you believe the people should know. So I was curious how you felt about that.
I'm not backing up anybody. Okay, I just have my opinion is that there's always the right time and the right place to ask questions. Those question that they ask will need to have an answer because you need to be transparent to the public, right? But I used to be in the Air Force. I'm retired 23 years, and there's a right time and right place. Those press conferences at that time is strictly for people to ask for the recovery plan, right? So there's a lot of questions there the media didn't ask, and the people need to know about the recovery phase. Like I say, those questions are valid. Those two questions are very valid. It's just not the right time, and I'm not quite sure Attitude handled that correctly during that time. I think muting at that time is the wrong thing to do. I think to me you should just say, those questions are valid. I will answer that question at a later time. But again, it's like I say, there's a right time and right place to ask, like I said.
Right, I respect your opinion, Doc, but if we're not given the opportunity to ask those questions, at any other time other than the press conference, and then it's also, what Adelut wants is they want us to text them questions, because when we text them a question, they text back a response, and nobody's face is on camera, nobody's on the phone to squirm. But the problem with that is if you ask a question and you get a text answer, a lot of times these answers we're getting, they only beg more questions. And so that's why, on our end, that's why we want to ask in a setting like a press conference, because you have a real person there who can give you a real answer sometimes. But then the problem with that is they give us an answer. If we have a problem with it, we've been muted, and we can't say, hey, that wasn't really what I was...
And also the questions that we're asking are on behalf of the people of Guam that are struggling, that are out there waiting in line for food. for food stamps.
I know
for
you get
federal
it, Doc. I
assistance.
know you get it.
Yeah, and
you know,
yeah.
those things have to be answered 100%. So that's, you know, when, like I said, everything we do has to be transparent, has to be accountable for. You know, I'm not quite sure when the right time, right place, but it has to be answered. You know, it's not a text. I mean, you can't put your thoughts and your feeling and everything to the public through a text message. You know, I mean, social media is good, but when you visualize someone answer the question, you can tell, you know, is that an honest question or it's just a political answer on everything. So to me, you know, transparent, you got to be. That's how the people trust the government. So,
right. And you know what's crazy is that you see the CNMI, they release their plans on how they are going to spend the $36 million in CARES Act money within the guidelines provided by the U.S. Treasury.
I mean, Jesus.
And we're still waiting for, where's this $118 million?
If the CNMI is doing it, what's Gov Guam's problem?
Yeah, I think that you know, all the money has to be accountable for and has to be somewhat on the public, say that it goes toward this, and this, so that way you know where it's going. But you know, like I said, those things need to be published somewhere that is accessible and to.
Right.
Well, in your physicians advisory group meetings, do they tell you like, okay, we're going to use $2 million to go to get, you know, face masks?
No.
Nothing.
I tell you, the only thing we really ask, we put plan together to approach certain health issue, and we recommend that. But no, we don't talk about money during the advisory board.
Right.
What about this? You know, this whole letter that we saw with the governor's signature and Linda DeNorcy's signature regarding the PacStar as a being used as a quarantine/isolation facility. Is that? Would you agree that a quarantine individual should be with isolation individuals mixed together?
No, we have quarantine hotel and we have isolation hotel.
So when it says PacStar is quarantine/isolation facility, is that? I mean, that's what it says in black and white. Quarantine/isolation facility.
That's what we have days in and the other hotel.
Yeah, you know, and that's what I had thought, that they had the isolation facility, which was days in, and then you had the PacStar, and I'm not even sure what other hotels are being used as quarantine facilities, although if it's our money being used for these facilities, we should know. But in the letter that I saw, it said PacStar quarantine/isolation facility. And you're saying that it should not be, these different sorts of groups should not be mingled together.
No, they clearly have to be separate, and that's why we have multiple. That's what we were briefed. That's what we recommended. So they should not be mixed together. Those only for people that are flying in to be on quarantine.
I understand that.
Yeah, and you know,
it's for people flying in, and also the chief of staff when he needs somewhere to put his head on his pillow.
I'm not quite sure that's the right answer. You know, like I say, I mean, it's a quarantine hotel, and there should not be a mix, and that's why whenever you turn positive, they pull you out and place you at a different hotel. You know, but not to stay there. The thing is, I know room is separately, but there's always, there's a risk of have a person that's positive, expose someone else. So that's why there's two, separate hotels, for two different populations.
Right. Yeah. And that's what we at least that's what I thought. I didn't know that it was a quarantine/isolation facility over at the PacStar.
Doc, if you just look at the military, I mean, they're keeping the positive cases on the base and the negative ones at the hotel. So even they seem to be separating these two groups.
Even if you turn positive in a hotel, they pull you out.
Right. This is the letter. It was dated March 18th. Dear Mr. Pothin, thank you for allowing the use of your property as a quarantine isolation facility. Pursuant to our agreement, the PacStar Resort and Spa is hereby directed to be used as a non-congregate shelter pursuant to the powers afforded by the Organic Act of Guam and Chapter 19, Title 10 of the Guam Code annotated. Sinceramente, Lourdes A. Leon Guerrero and Linda and Bingo DeNorcy. So does that sound like it's being used as a quarantine and isolation facility?
Yeah, it sounds like it, but it should not be mixed, and public health know that. So,
Well, there's a report that came out that Linda DeNorsi didn't even sign this thing, that they used a digital replica of her signature. I've been trying to get a hold of her all morning. I started my morning by sending a message to the policy director, Carlo Branch, and also the new acting chief of staff, John Jr. Calvo, saying, hey, what's up with these reports of Linda saying that she didn't even know you guys used her signature? So I think this is calls into question the whole deal, where you have the governor's legal counsel, who also happens to be her son-in-law, running around town calling shots with little to no checks and balances. You have the AG's office, and this is a subject we're going to get on with Senator Sabina Paris, Doc.
Yeah, that's the transparency that we have to go through. But like I say, those things need to be in really right in the middle. Either quarantine or isolation. But to me, even when you're in quarantine, you can see some people turn positive, and as I know that when you're positive, they transfer to another hotel, but not to be staying there. You should not be staying in a hotel that is nice and clean. That's what we term as a clean hotel and a dirty hotel. So. Just like GMH and GRMC, you had a clean hospital and you had a dirty hospital, and that term is just choose because to make sure that there's no chance or to minimize the chance of transmitting the virus to someone else.
Right. It's kind of basic, Doc. I mean, it seems pretty basic.
I know.
You don't put the sick with the people who aren't sick.
Yes, and once you go into a hotel for quarantine, you stay there for 2 weeks. You don't go in and out. So that's the part where I don't have the answer, but you have to accountable for and answer to the reason why they stay there. Even for the healthcare worker, if we, our option is that I can stay there on the quarantine hotel if I deem that I'm in danger to our family, right? I mean, if you have an elderly family at home and you work around COVID patients all day, they have an option to stay at the hotel during the duration of their exposure to make sure they don't give the virus back to their family.
Right, and that's another facility. I believe that's the Perlis Court.
Yes, that's but we don't stay at the Pacific Star.
But I think it's interesting that any regular Joe cruise lands on a flight into Guam. They got to go stay in quarantine for 14 days, but the former chief of staff can spend the night, wake up the next morning. Oh, I feel great. Hey, assess me. You're good to go, chief. It's just clearly, it just shows that the whole system of the integrity of this system, where we're
whether or not that's even going to be reimbursed by FEMA.
I mean, it's a hotel room. It's kind
and they got to make sure that they are documenting every single thing that's happening.
Doc, we're going to let you go because we're getting out of your. This kind of seems like it's above your pay grade.
Yeah. Well, real quickly before we do let you go, we're back to the study. You said that there were a wholesale company brought them in. How many test kits and what clinics are you looking at to implement this study?
We have over 1,000 of test kits. I can't know the right number, but what we do is that we give 50% of the test kits for public health to do their tests. Okay, and the other 50% we divide among 5, 6 other different clinics, and we're going to target some of the population there and test them at random. And also target testing and ask for their permission. We always ask. It's not someone that walk in and say, we're going to do a test, and we're going to ask, we're going to inform them it's a study. If the patient say yes, then we carry forward. So it's not a bad issue. Some private clinics, most likely, I can tell you AMC will be one of them, and to do the study, but we need to know. And we will privately use our money to do it. It's just basically, like I say, it doesn't hurt anyone. It just gives a physician-wise and the community to know, hey, what's the prevalence of the infection out there?
Right.
So just like those 6 cases that turned positive, it's nice to know more information about them.
Right.
It would be, yeah.
Okay.
Yeah.
And how soon do you think you might be able to do this? Or are you looking at?
We would talk to other private clinics, and we come up with a fund, and we would carry out the study. I mean, we can do that. So we will come up with our own fund to do that.
May 9th, is that still the target date to move into PCOR 2?
Not if you guys keep testing positive.
Yeah, Chris, but Sabrina, we can test positive, but again, it's a percentage of tests that positive that we look for. You can have 2 positive, but doesn't mean that we can move to the next peak.
Right. Yeah.
Because remember, percentage-wise, we have to say less than 5%. So, still good. The hospital, the criteria for the hospitalization, we still have 0 hospitalization at this point, so we can handle any surge. But like I said, we expect a second surge, like other places in the world does. But again, Guam is sometimes unique, and depend on people, social distance, everything here, and the density of our population, we might not have the second surge, but we have to kind of prepare as the other place has the second surge.
But again, you're still looking at May 9th to move into PCOR.
Yeah,
we got to get Dr. Cabrera and find out, like, how many positive cases would it take to derail this whole, gradual reopening of May 9th?
I tell you, it's less than 5% or of the tests that we do right now. That if you do 72 tests or whatever, 2%. So it's kind of small. So, again, it's not the number of positives we see; it's a percentage of the tests we run that turn positive. Including the other 3 criteria that they use there. Okay?
The ability to contact tracing.
The virus is still out there. Okay, bottom line, it's never going to go away. It's going to go toward the flu season in September. That's all we're going to pray about. It's going to get confused in the flu and the virus, the coronavirus. So it's going to go. It's still here. We just really need to open up, but we need to open up in a way that the people understand that social distance and mask is mandatory. It's a new norm for now. Okay.
Okay.
Okay, Doc.
Thank you so much for your time.
Thank you so much for your time, Doc. I really appreciate it.
When you find out who's blocking this at Adelup,
let us know.
Let us know.
You don't have to call. Just shoot me a text. Okay. Now they're not going to tell him anything. They'll be like, "Hey, you heard that on containing COVID? Yeah, don't tell Hoa anything."
Okay. Thank you.
Okay. Goodbye.
Care.
Wash your hands. Hey, our buddy Dr. Hoa. Let's keep it going here. We want to talk transparency. Bree, did you kind of want to go over this whole hotel quarantine thing, or let's bring on Senator Sabina Perez, who is your legislative oversight on procurement? And thank you so much, Senator, for taking our call this